sir, my tooth really hurts. Every time I go to bite down on something, I get a sharp pain on the right side of my mouth.
I'm sorry to hear that. When was the last time you went to get a dental checkup?
I don't know, it has been a long time. My mom is a single parent, which makes it hard for us to afford to go to the dentist. She said on the way here that we would have to cut back on our weekly grocery money so I could come get my tooth fixed.
It sounds to me like you have a dental cavity. Dental disease is the most common form of chronic disease in the United States. According to the Center for Disease Control and Prevention, over a quarter of children have tooth decay before entering kindergarten, and an astonishing 68% of youth will experience dental disease before the age of 19. Tooth decay affects 5 to 8 times more children than asthma. The most common form of dental disease, dental caries, is initiated by Streptococcus mutans, a pathogenic bacterium which metabolizes ingested food to form acids on the teeth. These acids demineralize the tooth enamel surface. However, this breakdown is preventable through proper oral health care.
I didn't know any of that. I have never learned any of that at school, and my mom has never taught me how to properly care for my teeth.
As a child, you are in a unique position in life that makes you especially vulnerable to the impact of improper oral health care. Because of the inability for dental enamel to repair itself, oral disease leaves permanent damage. You are unable to make decisions regarding your oral health and require the partnership of your parent to make choices for you. As well, you are more likely to have special health needs than adults. Do you mind me asking you a few more questions? Does your water come from well water, or do you get your water from the city?
My family lives far up in the mountains, deep in the woods. There are no other houses around us. We have a big tank of water which comes from the ground. So, I think we have well water.
That would make sense. Well water lacks fluoride, which is essential to preventing oral disease. Water fluoridation is one of public health's most cost-effective achievements of the 20th century, and yet only 62% of municipal water provisions are fluoridated. Fluoridation does not combat against all dental diseases. However, lack of access to fluoridation disproportionately affects minority and poor children, who are also much less likely to receive preventative checkups and practice daily oral health care. Do you know if your family has dental insurance?
I do not think so. My mom has to work 2 jobs to put food on the table. She is always talking about how she cannot get treated for her gum disease because she has to take care of us kids first.
Alex, you and your family are not alone. Children from families with incomes below the federal poverty level of 199% are 3 times as likely to have unmet dental care than their higher income counterparts. Factors which contribute to the disparity in dental care include unequal distribution of clinicians, few dentists who treat Medicaid patients, lack of pediatric specifically trained dentists, lack of knowledge about how to maintain oral health, and inability for low-income families to qualify for Medicaid or skip dental insurance. However, I am happy to offer my services today free of charge so you do not have to feel any more discomfort. I just have a few more questions to ask you. I am currently working with government to create change in the laws surrounding oral health care for youth. Your insights are invaluable to me. I am curious, what elementary school do you go to, and do they teach you anything about proper dental care?
I go to Jones Elementary. All of my friends are complaining about their mouths hurting too. I know we all come from the same part of town, and we all like to go to the gas station down the street after school to buy junk food with our lunch money. That's where my tooth started hurting about a week ago.
Although we have made great strides in dental care, there is still a large gap which must be filled between socioeconomic disparities. The recommendations I want to make for your school are to require sealant and monthly fluoride rinse programs, require dental education in the school curriculum, and require all the municipal water supplies to have fluoride in their water. I am simply curious, what is your favorite food? I can see you have some food in your teeth.
I love the cereal, Cocoa Puffs. Every Saturday morning when my friends and I are watching cartoons, the Cocoa Puffs commercial comes on and Kix is surfing on a wave of chocolate. He is so cool.
It is sad to me that the government does not regulate the advertisement of unhealthy food on the television, especially at peak times when children are watching. Rather, the government should create national service announcements about the importance of proper oral health care in children. The government fails to see the drastic cost savings and improvements in quality of life for its citizens through preventative dental care. Alas, I have talked your ear off, and I am sure you are ready to go. Remember to brush twice a day, and floss once. If you can do that, you will have a much better chance of protecting those teeth of yours.
Thank you so much. I'm going to work on cleaning my teeth so I don't get any more cavities.